So let's talk about temple filler. So as we age, we tend to lose volume in our temples, especially on our thinner patients. So on this beautiful patient, you can see right in here, see how she's kind of hollowed out and you can almost see her orbital bone? And this is something that is really easy to fill with filler. I'm going to use Juvederm Voluma on it, and we're going to use 1 syringe on each side. It is FDA approved. It's actually the newest FDA indication that's approved. We've been doing it for years. It's beautiful. On this patient, I'm going to use 1 cc on each side. Sometimes I'll use a half on each side and then we'll add to it with time. This is such a magical treatment. I can't wait to show you how it's done. Okay, so for this, like I said, there's 1 spot that you're going to hit. Kind of take it all the way down and then you just inject 1 cc, about 1/5 of a teaspoon, and you can see, like I can see as I'm putting this in, that it's just popping out nicely. See how much she comes out here now and it gives her that youthful appearance? Where on this side, she's still really concave in, so we're gonna add that. And that's 1 syringe. That's gonna last her about 2 years. We could always add to it. Some patients every year, like, hey, I need a little bit more, and that's an option too, but it's a nice long-acting filler. Not a lot of downtime. You can see she's not bruised, she's not swollen or anything like that. She can go back to her day's activities, no restrictions or anything after this filler. So it's just a really nice option.
Absolutely worth it. It really did not hurt at all. She's a doctor who used to work in the ER also, and I'm a nurse who worked in the ER, so we have a lot in common. She does such a fantastic job with everything that I just keep coming back. And already it's only been 5 minutes and I can tell a difference already. So I'm already very happy and I will definitely be back for more.